Hi, I've just come on today to have a bit of a chat with you about teething. So, babies will usually see their first teeth erupt around about the 6 months of age. Now, some babies, it's very rare, but some babies are actually born with teeth or will get their first teeth within that sort of first couple of weeks of life, but it is extremely rare. So, usually it is their bottom two teeth at the front that are the first to erupt. So, some of the signs that you'll see, babies can often become a little bit more clingy, crying a little bit more with pain in those few days prior to the tooth erupting. You can often see as well on the gums at the bottom there, it will look a little bit grey to blue over the base of the gum, and that's literally immediately before the tooth is about to erupt. So there are several signs. Your baby will also produce more saliva during teething episodes, so you will see them start to drool a little bit more and generally starting to put everything in their mouth that they possibly can to bite down upon, just to give a little bit of pressure relief to the gums. So what can you actually do to help your baby? So lots of cuddles, first and foremost. You can use a clean finger just to pop into your baby's mouth to let them bite down upon. You can use teething rings, and it's often good if you can pop them into the fridge. We'd never recommend putting anything into the freezer because you can actually cause like an ice burn, like a frostbite type ice burn if your baby bites down on something straight from the freezer. So just in the fridge. So you can put your teething rings in there, you can put your baby's pacifier, dummy, whatever you refer to it as, into the fridge. And again, that's just nice and soothing when they do put it into the mouth. The other thing that you can do is using just a washcloth or a flannel, wet the washcloth and then drain the excess water off and put that into the fridge as well. And that's nice for them just to bite down on their gums as well. Now, we don't recommend that you use the amber teething necklaces. There's a lot of controversy out there about those at the moment. There's just often, talk of a risks of choking if the little amber beads do come apart, and strangulation. So we wouldn't recommend using those as a method to assist your baby during teething. If you do decide to use medication, then we would recommend doing so in conjunction with your pharmacist or your GP, who would advise you on recommended dosages and age-appropriate medication for your baby.